This is a questionnaire from Inspira Health out of New Jersey, which contains the following questions for parents of newborns. What sex was your baby assigned at birth? What gender identity do you assign your baby? And finally, do you describe your baby as lesbian, gay, straight, or bisexual? We should point out, though, that patients do have the option not to provide an answer.
But the form was obtained by Republican New Jersey State Senator, that is Holly Schepisi, joining us, who is fighting to have this practice rescinded in the Garden State. You know, and thank you for coming on. We do appreciate that, State Senator. So we see this questionnaire, and you may be going, is this real life?
In fact, when I saw it, I thought maybe it was something made up to be provocative. So I had my staff reach out directly to the health network to confirm that it was indeed real, because you looked at it and you go, there's no way. Like, it's so stupid. It has absolutely no efficacy in the medical world. And how are they providing this to parents of newborn patients?
I mean, this is a statement when it's absolutely absurd. I mean, sexualizing a newborn child, asking how they identify. But this is a statement from the New Jersey Department of Health spokesperson saying that the department stresses any collection of sexual orientation, gender identity data. It should be done in a clinically appropriate and culturally competent manner, including patient populations for which certain data may not be appropriate, as in the case for newborns. Now, then they recommended that hospitals develop internal policies and procedures based on clinical advice to assist their employees in collecting such data. Are they trying to walk back now what they're having mothers fill out for their newborn babies? I mean, what does this statement tell you about their reaction?
I think once again, and it's kind of like, as Van Jones said, Democrats have realized that they've gone too far. The entire legislature, as well as the governor, is up this year in New Jersey. And I think you're starting to see, once the public expresses outrage, a walking back of some of the more insane policies that have been implemented under this administration and under Democratic control in the state. Had this not come to light, had the publicity around it not occurred, hospital networks were under the impression, based upon direct communications with Department of Health, that they were mandated under this law to provide it to all populations regardless of age. I have new legislation that's being introduced on Monday that is going to specify that minors are not part and parcel of collection of this sort of data.
And it's going to be interesting to see with that legislation who's for it and who's against it, right? And just getting a roll call on that will be fascinating for the future of those political careers. Just based on this questionnaire, I have a 7-month-old. And if they handed me that questionnaire, I would have thrown that in the trash. It's right with her first dirty diaper that I changed immediately. It is unbelievable. How did you first find out about this questionnaire that was given out at New Jersey hospitals?
As with a lot of things, it was through social media.
Yeah.
I was lying in bed. I was scrolling through. I, too, am a mom. I have a 13-year-old. I have a 21-year-old. And a mom had put up, who's 9 months pregnant, that she had gone in for her check and was given a packet of forms and had gone through it and saw this for what she's supposed to provide pre-birth. And that's kind of the entire genesis of it. Although the law was passed in late 2022, as with all things, from passage to implementation, there's always a gap. And so I think the health networks have started to expand out their questionnaires. And I know it's full spectrum. I mean, my own dad, who's 80, was in the hospital 2 years ago for a gallbladder issue. And they came in, and instead of providing him care as he was writhing in pain, he was asked multiple times, what's your pronoun? How should we refer to you? Have you been pregnant or had an abortion any time in the past 6 months? And my dad's 6'4", 200+ pound, almost 80-year-old man. And he got very annoyed and finally reached a point where he was like, okay, you're just going to call me King John and get a doctor in here.
Information. Truth is freedom. Is Newsmax. It's real news for real people.